Cynical from Building Bright Futures.
And I'm Jody Brakeley, a developmental behavioral pediatrician, person at large.
And we know Fred is actually taping this, and it shows up in the archives of Missouri Community Television. So don't say anything that you'll be embarrassed about later. Or if you do, just make sure that if you say it in a mumbling voice. And our main goals for today are, we'll do a quick overview about the current situation of child care in the county, where it is, how to find openings, how to get on waiting lists that you can share with your employees. We'll talk about the existing public financing for child care. We're going to try to do this all very fast. And then our main hope for today is to hear from each of you about what you would like to have happen, if anything. So, is that what you all expected was going to happen this morning? No? Okay. Why don't we quickly go around? I think that, are you going to take notes, Jody, or shall I take notes?
I can take some notes.
So if Jody's going to take notes, maybe we could do just a quick round of introductions and start with you.
Yeah, well, I'm Caroline Carpenter, National Bank Millbury, and my HR officer, Heather's supposed to be here, so should I go check the door and see if she's stuck outside?
So maybe.
I can run downstairs.
I just could do
that.
a little good at that.
Oh, she had planned on.
She had planned on it, and I think she was planning actually to be teaching shares.
I wouldn't want
Yes.
to. Hopefully we'll find her.
I'm just watching that.
Okay, I'm Ulti Danforth. I'm the, excuse me, Human Services Instructor at PAHCC. And a number of students who come into my program are interested in going into early childhood.
So you're actually raising the next generation of
Care
providers.
That are going on to post-secondary in the interest of supporting in the future.
I'm Rob Carter. I'm president of the Addison County Chamber.
I'm Helena Van Vorst. I'm the executive director at United Way of Addison County and mom of 2 young children, which feels relevant.
I'm Pam Russell, and I'm from Vermont Coffee Company. So I do a little bit of the HR as well. So we just have employees who have young children, and so we're just trying to figure out ways that we can help them.
I'm Amy Carlin, and I work with Sue Ritter in Community Relations at Middlebury.
I'm Nicholas Wood. I'm from Vermont Integrated Architecture. I'm not actually an employer, I'm an employee, but I guess representing them, gathering some information, I'll report back.
Elise Schanbacher, I'm the executive director of the Addison County Community Trust. We run affordable housing in Addison County. It's definitely a key for our residents. We're about to break ground on new housing in Virgins on Armory Lane, where we would love to see Mary Johnson be able to get an infant care center off the ground. I have one employee expecting in August. I'm expecting in September. So it's definitely a salient issue for us, and kind of pie in the sky, being able to maybe sort of join together with other employers in Virgins and create some kind of employer-based contribution partnership with a child care provider where we could sort of contribute to a center or place for our employees to provide child care.
Fred Kenny, Addison County Economic Development Corporation.
While we're waiting for other people, I'm going to just quickly go through this overview about what's going on in this county for child care, and I'll send you these slides because there's a lot more information than we'll actually have a chance to talk about today. So we just want you to know a little bit about the landscape. We'll keep on talking to see what we can do together, and then we'll cover some of the available resources, and we'll start work on developing new ones if need be. So there's 3 main issues that people talk about when they're thinking about early care and learning. One is, what's the quality of the program? We know that makes a huge difference in the child's development. Is it accessible to families? That means both physically in the towns where they need care, but also can they get into the programs? And is it affordable? So if we look at quality, we know that this is a critical factor, that the first 1,000 days of a child's life are unbelievably important to how they will grow and develop. And if any of you would like to have Dr. Brakely talk with you in more detail, she can do a fabulous overview about what's going on with the brain science. Hi. She can talk about the neurological connections that children are making during those years. She can talk about how we can help. Yes, it's the best way to say. And we also know that what happens during these first 3 years has a lifelong impact. So it's the basis for social and emotional literacy, for children's problem-solving skills, for their critical thinking, for their self-regulation and self-care. We sometimes talk about executive function, for their sense of resilience. And you've probably all heard about the ACEs, the Adverse Childhood Experiences, the study that looks at long-term chronic health conditions in adults and can trace huge numbers of those back to these adverse experiences during the early years. Do you want to do a quick intro?
Sure. I'm Emily Blistine. I am the Business Strategy Director for Let's Grow Kids. And I came to the first meeting, so my job at Let's Grow Kids is statewide. And I'm working with businesses both internally to help assess their own benefits and practices to support their employees' childcare needs, and then externally to become champions for us to speak about how important this is, how it helps their workforce, and really to just get involved in any capacity.
And Emily, like Olty, needs to leave at 8:30. So.
I do. I need to get down to talk to businesses in Brattleboro.
But our hope is to establish that connection, because if you want individual support in what you're working on for your business, this is the lady to go to.
So we're doing a business pilot right now where we're offering free technical assistance in exchange for lessons learned and walking you through the process and getting the best information possible.
And if you didn't sign the sign-in sheet last month at the meeting, and you want to be kept in touch, it's over here, so just make sure you get signed on to it. The other thing that we talk about a lot in this county, as well as all over the state, when we're talking about quality, is STARS. And this is the system that's been put in place in order to really assess quality. There are many wonderful programs that don't have 4 and 5 stars yet because they're not there in the application process. They could be there. One of the things that happens, again, through Let's Grow Kids and through our directors group and our family homes is really helping to make sure that all the programs in our county are very high stars. And it's critical for many of your employees because only programs that are high stars qualify for the universal pre-K funding. So if your families want to be able to access that funding, they need to be going to a program that's been pre-qualified based on the quality. So affordability, accessibility is the next. This is just our Addison County population. You're seeing, we're having about 300 kids a year born who live here in this county. There's actually about 350 kids born at Porter each year. We're becoming one of the biggest delivery hospitals in the state because the birthing center is so cool and people love the support that they get. So people now are coming up from Rutland. A lot of people come from across the lake. But in terms of how many children are actually here in the county, the cohort is approximately 300 a year. So you'll be adding to that in September. Universal pre-kindergarten, this is one of the few sources of financial support for your families for high-quality childcare that is not income tested. So this is 10 hours a week, hey Donna, that's available to any family whose child is 3 and 4 years old who's attending a program that, again, meets these high-quality standards. So we do know this is information that was gathered by Let's Grow Kids. More than 70% of the children under 6 have all of their available parents in the out-of-home workforce. Very high number. These are the numbers of slots in our county as of last year. And what you'll see is that in terms of preschool, we're actually fine in this county. We have openings now for preschool in New Haven, in Bristol, in Whiting. There's a new program coming online in June at the Ridge School. So as far as preschool goes, pretty much your employees can find a place that's appropriate, that's high quality, and that qualifies for the universal pre-K. But if you look at the infant and toddler slots, we are way under, and you think about 300 kids a year being born and 70% of them need childcare, we're way under capacity there. So a couple of things that have happened. There's something called Make Way for Kids. These were grants that were provided by Let's Grow Kids to expand infant and toddler slots in the county. Mary Johnson got one of them. I think that Elise mentioned that. The Whiting School, which turned over their school building to a child care program, got grants for slots. It's pretty far away. But it is maybe a model, as we're also having these debates about what do we do with our dwindling school populations and our school buildings and how we use them. So this is kind of the lay of the land. It is hard to find infant and toddler slots. And our preschool is in great shape. So when we talk about affordability, there's two issues. One is the affordability for your employees. What percentage of their income do they need to pay for childcare? And the other is, can the providers, the childcare providers, afford to stay in the field? So one of the things that we've learned is, especially with those that are serving our youngest kids, there's close to a 40% turnover rate each year. So for all these students, as they graduate and think about where they're going to work, are they going to work in the public school, are they going to work in the private sector, we need to do something to make sure that this is a viable occupation and profession for people. Linda January, who's also on the Early Care and Learning Partnership Board, couldn't be here today, so I'm not going to go through these, but these are just showing you what, this is the Otter Creek Children's Center, you probably know it, it's on Wayward Street. These are what the typical costs are. Their program is pretty much in line with other high-quality programs. And what it means for families is for a two-parent home with a preschooler and an infant, they may be paying up to 34% of their income. It's pushing housing at this point in terms of the biggest expense that families with young kids are going to have. For a family with just one child in care, 22% might be a pretty accurate figure. And for, you all maybe know Dan Smith, who's the new director of maybe the 3-year-old director of the Community Foundation, who had twins 2 years ago and he just had a new baby. So this is a family with plenty of income, but they'll be struggling just like the rest of your employees to pay for their child care. So in Otter Creek, what you wanted to let people know is that even though it's expensive for parents, the tuition does not cover the full cost of care. One of the programs that does help families pay for care is the Child Care Financial Assistance Program. And maybe Emily will do an update for us in a minute, or Donna, who was on the Blue Ribbon Commission. There's been legislation to really increase who gets covered and how much they get from this program. Wonder if you jump in and say whether that just, did it pass this week?
It got folded into the budget bill, as I understand. It passed out of the House unanimously and passed out of the Senate, but now and then it got folded into the budget bill. So I don't think it's
not a done deal yet, but close. Again, this is a means-tested program, so it's not going to work for all of your employees, but by raising the upper limits of who can be covered and raising the amount that they will get covered for rather than just 10%. Many more families will be getting 100% of this kind of subsidy. If it passes, it will be a big help for your employees. You don't need to know how to run these numbers for your employees. We'll tell you who to call who can help them. So this was the commission that Donna was on 4 years ago? Anyway, it was just a while back.
Time flies when you're having fun.
They really looked at the costs of providing high quality care, so there's an amazing amount of excellent information. This is James Heckman's The Impact of Programs, a variety of programs in terms of return on investment for us as the public. And you can't see these numbers, probably, oh, maybe you can, but basically the earlier we're providing support for families, the bigger the impact, the return on investment for us as a community. And this is where the return comes from. It comes from kids not having to repeat grades, it comes from lower special ed costs, it comes from lower costs of substance abuse or other challenges that kids who have not gotten a good start might be facing. And it comes from parents being able to be in the workforce and to contribute to the workforce. And you'll get that in your slides just if you need a reason. So there's a pile of reports. You'll be able to link to all of these if you want to when I send you the slides. And then there's one thing that we actually, I never know how to do this. Just see if we can turn this off. We did want to walk you through how you can, right now, even before we do anything else, support your employees in finding a home for childcare. But since you're going to need to leave, Emily, I'm wondering if you want to jump in and share anything before I launch into this.
Whenever would be helpful. So we are working, as I mentioned, we're doing a pilot project where we're really working one-on-one with businesses, and the goal is to get businesses in different industries of different sizes and in different regions so that we can have different models for other businesses to look to. So we're continuing to expand that program. If there's anyone there who's interested, I can talk about that. I also have been going into communities where a few businesses might want to talk about what they could do together. So that's what I'm going to do down in Brattleboro today. And so a lot of that is initial conversations about hearing from businesses what their specific pain points are. So some may be struggling with recruitment and retention, others with productivity, others with just their employees being able to find care and so not being able to come to work at all, or a lot of younger families who, especially the mom will leave, plan to come back and then can't find childcare, so those positions are open for longer. So we're often in those groups trying to gather what the pain points are of that group and how they could come together. What I'm moving toward is working with businesses internally, because the community conversations are wonderful, but oftentimes the needs are so mismatched that that's a longer conversation that needs to go along at the same time that businesses look to see what they could do now. My whole goal is really to let businesses know that no matter your size, no matter your industry, there's something you can do. So we're working with a lot of low and no cost options. So those include changing the culture, making sure that, you know, if you have the ability to be flexible with your workforce, that we're not just saying, a lot of businesses say, oh yeah, of course we have flexibility, folks can leave to get their kids if they need to, but that's not really enshrined in the benefits package in any way. So getting those things a little bit more secure so that employees really know that they can take advantage of that. And then there's some lower cost options, like either just administering a flexible spending account for dependent care, and some businesses are also choosing to seed that with some financial support to help them, to help their employees for that small period of time offset the cost of care so that it's worth it for them to return to work. As any of you know, Cheryl showed us the numbers, but if you have a couple of employees making $32,000 a year, and then they're paying up to $12,000 or $13,000 a year for one kid, if they have two kids, suddenly they do the math and realize it's not worth it for them. So I'm really talking one-on-one at this point with a lot of businesses, and then moving to bigger presentations. I was just at the VBSR conference today, Friday, on Wednesday, and we were talking to that group about really starting the process of thinking through what they can do today to make their businesses more family-friendly. So I'm available for resources. We're also, from this pilot program, trying to build materials so that businesses can come to us and start looking through what they can think about doing. So we have this menu of options, which we had last time, and I can email to anybody who's interested, which just sort of lays out some of the options that I was talking about. And then we're really surveying businesses. A lot of what's been happening for businesses supporting childcare nobody writes down, so we're calling them and trying to figure out what businesses are actually doing and building little models, so we can just say, Middlebury College has X number of employees, is in X industry and X region, and this is their benefit. And then, a smaller business with 10 employees in a different region is doing this, so that you can quickly skim and see who are my peers, what are they doing. And from that, we're building bigger profiles. So we just finished our first one for Casella, who came to the last meeting that we had here. And basically what that does is it shows a little profile again of what this business looks like, how big they are, and then we grabbed quotes. We worked with their CEO to get a quote from him about why it was meaningful for him to do this program, and we reached out to their employee base to get a quote from the employee about what their scholarship program means to her. So we're trying to make sort of more of an emotional case that this can work, and it's something that no matter where your business is at, and even if, for-profit, nonprofit, we should say employers rather than businesses. No matter what kind of employer you are, there's something that you can do. So we have a new website as of last week. So those materials should be there. So on letsgrowkids.org and then /business.
So take advantage of Emily
Please
if
take
you
advantage
want
of me.
individual consultation. Some of the things that have come up, and we can open this up now, people have been saying after Shelley's presentation. So how can you layer together a Section 125 plan that covers dependent care with maybe an employer-supported scholarship program with this child care financial assistance? And I don't know, Heather, who works with Carolyn, said, I don't know the answers to this, but let me know your questions and I'll research it for you. And Alexa Euler, who's the HR director, the counseling service, which is also a very big employer in this county, said, this question has been driving us crazy for a long time. Let me know what your questions are, and I'll happily work with Heather to find out ways that we can do that. So a quick, this is what you can do right now today for your employees in terms of helping them understand how to get on waiting lists, how to find a program, how to pay for a program. First thing is call Ginny Sinclair. And Ginny is the referral specialist. Her contact information is on here. She stays on top of all the openings in the licensed and registered programs in the county. So she's a great starting place for everybody, and not just for low-income families. I think the more you all send your employees who are looking for care to her, the better the database is going to be to say, these are the families that are looking for care, these are the ages of children, and these are the towns that they need care in. So it will help in planning. Maybe it will help you with United Way as you're thinking, where do we really need to make investments in child care? What Ginny cannot do for your employees is give them a list of names of people that are not licensed and registered. So for those of you that have worked in the elder care world, I had to take care of my folks, there are the formal programs, and then there's also the list of people who are self-employed and do this kind of work. Ginny can't pass that out, but maybe that's something that as a community we'll decide we should start to have a list like that, and then we can take and help those people become registered and licensed if people like working with them. So that's another option. So Ginny is also, she'll be your entry point for your employees to the child care financial assistance that I put up here earlier. So she will say to them, gee, I think, and it's very convenient because the woman who does that sits right next to Ginny. So she'll say, so why didn't you just talk to Jane? I think you might be eligible for child care financial assistance, and Jane can help you fill out the form. So she will do that. We, as the Early Care and Learning Partnership, have been working a lot with pediatricians. Our hope is that eventually healthcare financing will help to support high-quality early care and learning because of what we looked at earlier, that it really, what's happening in these first 3 years is the basis for the long-term health of our population. But it was not as easy as we thought it was going to be. So, but you can ask your physicians right now, if a parent is concerned about their child's development, either physical or behavioral, they can ask for a referral to what's called Children's Integrated Services. There's, again, a woman in the community named Demina Noonan who can help that family find not just appropriate childcare, but also PT or OT or speech and language supports, or perhaps therapy for the parents. So it's maybe, Donna, you're the contact person for this now. Do you want to tell us a little bit about how that works?
And Children's Integrated Services, hi, I'm Donna Bailey, I'm director of the Parent Child Center. So what, those referrals, Demina is one person, but we have a team of outreach workers, so mostly social workers and folks who are trained in early childhood development and family support. And so when referrals come in, it can be Demina, it can be any of the other folks on our staff who help people to find childcare, do the paperwork, call Ginny, do all those things, so and support people. And if there's a need for, if there's a developmental issue, then folks would be helped in a medical model as well and get some physical therapy, occupational therapy, speech, language. So those are, and those services can it can be happening in a family's home if that's their choice, or in a community space like childcare.
And I think from a medical point of view, Children's Integrated Services, Donna, is one of the first places that you go. It's always simpler for us if we have only one number to call. And so if we call them, we know everything else is going to be taken care of, and it's a huge relief, and we can go forward. So thank you for that work.
And Donna's phone number is not on this piece of paper that I handed out to you. So I will tell you now. You call Donna at 388
317.
3171.
And Jenny's is 434. No, sorry. We have all the
Yes.
members.
And Ginny's, is it Mary Johnson? And
Yes. I just want to make sure Ginny is the referral specialist.
she's the one that knows where all the openings are. She's the referral specialist.
And leave a message, because she doesn't work full-time, but she will get back to you, and also she can gather that info.
Right.
She has an email address.
Yeah.
Yeah.
As do I, and you can also go to the Addison County Parent Child Center website, and there's an info which goes right to my email as well. So there's an info email, so you can just look it up online if that's your preference.
I think what we might do after this meeting then is send you all the list of these people, their names, their emails, and their phone numbers. As Jody said, it's so much easier for parents to just have to go one place instead of.
I also wanted to offer that as a nonprofit director of, we have 30 employees, and we have a Section 125 plan and a benefits plan that includes support for childcare. So if anybody
Interesting to know.
pick our brain,
Yeah.
We might do a little of that in just a minute. So there's two other sources, and again, either Donna's going to help your employees get there, or Ginny's going to help your employers get there. If your employees have kids who are 3, they become eligible for this universal pre-K, which is 10 hours a week for 35 weeks of the year of free tuition. And those programs are, in our county, are typically within childcare programs. So it might be at Mary Johnson. Is the one, is Hattie's program a
Layla, we are pre-K certified.
So this Bristol Family Center is pre-K. The programs that I was saying, we have a lot of openings in preschool in the county, and they all, Ridgeville is not yet enrolled in that, but they're hoping to be by next fall. But all the other programs that have openings are also universal pre-K programs. And again, somebody will help your employee get there, but the woman's name is Meg Baker. I'll put it on a piece of paper. And then if your employees are very low income, at 100% of poverty or lower, they get their free Head Start services, which cover child care, education, referrals to, do you want to talk about Head Start? They used to be with you, now they have a freestanding program.
So there's an early Head Start as well as a Head Start program. So early Head Start helps in infant toddler programs, community-based programs, where there is support for families who are low income, and there's different categories to that people can fit in a box. But regardless, families who are enrolled in Head Start will receive not only high-quality childcare, because there are requirements through Head Start, through the federal government for local providers to be sure that they're high quality, and they also receive other support services. There's parent education classes. There's some limited home visiting. There used to be much more, but and there's also supplies like diapers and things like that, which can add up. So those are all supports that Head Start can provide to an individual family.
And then there's one other kind of childcare, which is for special needs childcare when the parent has special needs. It might be that they're in a treatment program, or they themselves have some developmental disabilities, or it's a period of unbelievable stress in the family's life. And that also is covered pretty much through CFAP, and some of it is coming through Medicaid and health insurance. So those right now are the publicly available tuition supports and scholarships. But then the other thing that's going on is many of you are supporting your families with various things. I wonder, do you want to talk about the college's history?
Oh, no.
No, okay, never mind.
I'm just gathering information. Best to talk with.
Okay.
Yes.
I apologize, I think it's about.
I think it's time for you to go, because.
But thank you, everyone. I look forward to seeing you again, excuse me.
And I do too. I'm going to leave my cards, and I would just leave the parting thought that we've done a lot of surveys for employees, for employers of their employees, and one thing that comes up universally is this desire to just figure out how to find information. So to the extent that you have an internal system or an internal website that you could have resources for them, that can be incredibly helpful, just with these numbers that Cheryl talked about, and even if there's the chance for them to connect with each other about which programs they're using, because often we find that, you know, 2 people serve most of the families in our office. But there's a lot of those low barrier things that can happen soon, just to hear your employees and provide some information for them. So I'll leave my cards over there. Thank you.
Thanks for swaying Emily out of your way. So one of the things that the 3 of us are working on as the Early Care and Learning Partnership is we're working with the Addison Independent, that once a year we'll be putting out a hard copy list. If you think about the ACORN Guide to Local Foods that comes out once a year, it's primarily a way just to let people know what's in the county. We know that it's going to be out of date as soon as we do it, but we also wanted it to be available for all the real estate agencies, because a lot of realtors are saying this is an issue for us, and people coming to say, should I be in this county? So you'll have that. That will be available. Christy thought it probably won't be ready until September, and then we'll try to do, the state maintains a website that is challenging to use, so we'll try to have a more up-to-date website also about all of the resources that are available. But I think one of the things, I'm hoping that Heather didn't come and knock on the door and not get in, and now she's lost, so.
I've got all of this.
Okay, that Heather and Alexa said they could help us. Do you want to talk about what the bank does with, do you guys do 125 plans that have dependent care, or should we ask somebody else to?
I'm in the same boat. I don't want to tread too far into our HR benefits and say something that's not accurate. But, you know, the accessibility, availability is, and that's the hardest one, you know. Yeah, money is scarce, but money is simple. You know, it's really about finding it. And interestingly enough, over the years, we've created many positions that are during the school day. This goes back to the school age. Thinking that would be really helpful and popular. No one wants those jobs because they want more hours than that. So we often have to change the job to be more hours than what we intended to attract people. So we're in this catch-22 of, we can create a job where you can be home by the time your kids get out of school, but people don't want the job, and then they can't get the coverage. It's just such a catch-22. I think in all these years, we've had one person take advantage of that and we work during the school day. So that's why I keep bringing that up, because infant and toddler continues to be this enormous challenge, but the school year and the work year and keeping people in the workplace and people need to make a living, and school is where, I saw your school age slots.
Yeah.
I think those may be more slots than we were even aware of, so we've got to find where those slots are to help.
We'll send that, but do you want to address this from your former life as a rec director?
Yeah, it's a slippery slope. For 17 years, I ran the rec department in Bristol, and it's that what works for families, what works for instructors, especially in the summer. Everybody wants all day, but instructors only want to work like 9 to 3, so that doesn't work for any family that I know. So it's a very slippery slope. And then you have the other hand, kids' attention spans only last so long. It's one thing if you're at the river and you're playing all day and we can play ultimate frisbee and keep them engaged that way. But in a program, if you're just doing pottery, 6 hours of pottery is pretty much going to be your max. So it's tricky to I feel your pain. It's tricky to find that. We were able to offer sort of before and after care. That didn't turn out to be, that's what everyone said they needed, but when we offered it, they didn't take advantage of it. And we did it for several years. So, constantly sort of, taking the temperature of what folks need, trying to offer it, offering it more than once, because one time they may not know about it, whatever. But it was never something that we were particularly successful at, and I've talked to other departments around the state, and they've had the same sort of thing. I mean, larger communities have better access, like Burlington, their before and after care is very well attended. That's sort of critical mass, I believe. And of course, they have more businesses in that area. Being rural, transportation was always an issue to get kids, to and from, if parents were working. We tried to, offer a bus system a couple of summers, and that got to be costly for the number of folks that were using it. I think it's just always reinventing the wheel. There's no one answer, and I think it's just something you're constantly need to, like I said, take the temperature and try it. Something's going to stick eventually, but there is no one answer. In my experience, I think Donna, you would probably say the same thing.
I think before and after care is always tricky because people want continuity of care for kids, and
right.
There's so many factors, but I think in our world today, kids are used to full day, full care, child care, and I think it depends a lot on their age and what the programs look like, whether that's a good thing or not.
Do you want to talk some about your 125 plan, Tracy?
Well, I can just say that we have a 125 plan, which is that, cafeteria style plan, right, for employees that people can, unfortunately, we're in a position where people have to choose that or a fully paid for healthcare plan. So but people get to make those choices around how then they're going to spend out of their own pocket as well. So, but dependent care is, an allowable, expense in section 125. So we offer that, and we're able to subsidize, our own program if the staff's children are in care because we have child care, or, another program. So I don't know what specifically.
So one specific question that came up, I can't remember who asked it, was when you have a 125 plan, your reportable income drops. So your employer is paying less in FICA, they're paying less in unemployment taxes, they're paying less, I think, in workman's comp. And you are paying less, and can you drop it far enough to then be eligible for the child care financial assistance? Do you know how it interacts with that?
I don't want to say the wrong thing there, so I don't know specifically, but I could look it up. But honestly, it's not too far a drop for us because we pay horribly. So, we pay better than most in the world of childcare, and it's still not good enough. So, I think it also depends on what brackets folks are in and all of that. So there's a variance there. I don't know the specific math, but it does.
But I guess we can ask
conceptually
a question maybe that Heather and Alexa can research for us.
Sure.
And I'm wondering if people have other questions about do you all have 125 plans for your employees?
We do.
Of cafeteria.
Cafeteria plan.
Right.
Yes, cafeteria. Which changed with the Obamacare era, with, you know, ARA and all that, because it used to be included, now they sort of split up.
I can't help anyone use it, so that's like, I'll probably be in touch with Emily. I'm identifying some things, like, we have pretty good practices and things that are starting to get baked into our culture, but none of it's written down, like she said, so starting to do that. We offer 125, it's new because we used to pay 100% of our healthcare premiums for our employees, so we didn't need one, and then we switched to cafeteria. So learning more about what that is so I can help people use it. I need to start doing it, obviously. We do things like ACCT will follow the school calendar for just for snow days and have it be an administrative absence. So we'll pay for that so people don't have a childcare issue for up to 5 days a season, but that isn't like written down as a benefit anywhere. And there's kind of like an informal rule of thumb policy where if somebody is taking care of a kid and they want to do some hours remotely, it's a little bit negotiable. Like my plan is to kind of work half-time remote for part of my leave, and kind of if I'm on childcare responsibility, obviously somebody can't telework and have full-time childcare responsibility for a kid, but if they're able to sort of put in 4 hours, then we'll be flexible about that. None of it's written down anywhere.
Exactly what she said is true for us. Yeah.
So there's a lot of not written down.
Exactly. Yeah, I think the culture is we're flexible. There aren't that many of us that have small children in my office, but yeah, when there's a snow day, you know, it's sort of everyone stay home for your own safety, but also if you have kids, like it's more convenient. So, but yeah, none of it's written down.
Fred, is the HR support something that the Economic Development Corporation can do seminars about? Do you have contacts of people that could come and help a business set up a cafeteria plan if they don't have one?
Sure, yeah, in fact, we're doing an HR seminar next week, but it's not on that specific issue, but that's certainly one we could build into the schedule.
Yeah, I think that would be great. It was trying to set up trying to overhaul our healthcare offering was a big confusing to do, and basically the only resource I had was going through like Bristol Financial Services, which is great, like Sean's helpful as far as he goes, but then it was like, oh, out of the blue I actually need to hire somebody else for a lot more money to write my 125 plan, and I don't even know what this thing is. And so there, like, I definitely feel like there's a little bit more of a need for a kind of layperson, employer-based HR support for some of these sort of complicated HR benefits.
We did a seminar last year on setting up a benefits plan for smaller companies as well. So there are people out there that can.
So it would be great. That might be, if we could add that to our list of resources, that would be helpful.
You know, it's interesting to me too, because I think both as somebody who does childcare and family services stuff, and also as an employer, I think that's the interesting thing from my perspective around what we need, because I think policies and all that are family friendly are really critically important. You know, and I think family leave and all these things. I think, you know, we have a short-term disability, which makes me crazy that we call it a disability for somebody that have maternity leave, but we'll take it. So, you know, so I'm excited about family leave, and it doesn't replace the maternity leave. I've tried that math, but it doesn't. So, but I think that, you know, a lot of employers are doing the right thing in that way, but I think there's the much softer side of, which is also really hard, because as a nonprofit, it's one thing, as somebody has to have, you know, bank tellers there every day and like all of those things happening. You know, how do we create a culture that says when you have a small child, we have to prioritize that in our community. So, and that's both in businesses and beyond. So I think working with families about creating, you know, a network of support, that's really a basic thing, so that, oh my gosh, I'm out of sick days, what am I gonna do wait, I have so-and-so I could call, or, you know, and some kids are out a lot, some kids aren't, you know, so I think those are the things, so to really sort of meet the need of individual employees and figure that as you go, but I think keeping the big picture in mind, because I think supporting employees when they're in critical times in their life, whether it's their new child or their aging parent, I think helps create a culture where people stay at your job, at their jobs, and that's a community that I want to be a part of and live in.
So could we ask two questions? We thought at one point that having a community-wide scholarship would be helpful to a lot of businesses, that you could, instead of having to set up your own scholarship program, you could just contribute to a community-wide scholarship and say, I want my business's money to go to my employees only. Is that something that's of interest, or is this issue of we just need more childcare, meaning the three of us, should be focusing our energy on that? Do you guys have a sense of that?
I still think it's an interesting idea, because I go back to, if there's no availability, I remember there was a quote in the newspaper from someone who worked at the college who said, gosh, if affordability was our only problem, you know, because at some point, you know, we could give money to the employee for childcare, but if it's not there, which goes back to those problems around making sure that providers are well paid, so they go into the profession and stay in the profession. So it's still, to me, a creative problem solver for trying to get at it from that angle. And so I don't want to lose that, but still supporting the employee directly is still job one. But we've got to
Support the child workers. You had it.
I didn't have anything to say.
Oh, okay. Sorry.
One
Yeah.
comment, I don't know, you know, I'm still, you know, coming into this in terms of all the availability, but I just met with Sarah at Bristol Family Center this past week, and one of the things I was talking with her about is the possibility in terms of business connections, of the businesses helping these care centers to expand and grow and offer more space, more, you know, more opportunities. Because sometimes it's really just a matter of, we can't expand because, one, we don't have the space, and two, we don't have the care workers. But if there's more of a partnership with businesses that have needs in that area, for instance, you know, they're building a new business park in Bristol, well, that's going to bring more employees. Well, employers aren't going to want to come there if there's not childcare and housing, et cetera, you know, somewhere in the community for their employees. So I don't know if there's conversations that are coming up between, you know, with businesses that want to support the actual childcare facilities, if that's an option.
I think it's something that we should keep exploring. At least you were mentioning your gems, that maybe that's starting to emerge.
Well, so two things. One was like it's on my wish list that there were, you know, there's a critical mass of employers in Virgins and some childcare provider or partnership or some kind of thing to connect us to, where we provide some financial support, buy into it, kind of co-op model. And then the second thing is the other place to integrate childcare that other counties are starting to move a little bit more quickly on than we are, is integrating it with the affordable housing as well. And I don't know exactly where Mary Johnson is with their center in Virgins, other than that infant care is super expensive.
So it sounds like this would be a productive, for those businesses that are interested in pursuing this, can there be a business support for expanding slots would be a productive discussion for us.
And also include developers there as well.
And include developers and affordable housing providers. And I guess our other question is, what about doing what the elder care world does, which is maintaining a list of people who do this work as they're self-employed, so they're not currently within the license system. Some of them are licensed, some of them are nurses, but some of them aren't. Or is that a slippery slope to say, we just don't want to go there?
Yeah, that's a tricky one. For myself, I think it's a slippery slope. There's a lot of training that goes into being, an early care provider. And, it used to be the lady down the street could watch your baby while you went to work. And now we know that there's a lot more learning that goes on at that time. So while that's an option for folks who choose that, I think as an entity to support that could be difficult. But I could be wrong.
Even just more organization of the licensed. So, I reached out to Ginny, and it took a little bit of back and forth for her to figure out where to start me, I guess, because I'm like, I don't know, give me the name of every provider in the county. This is my first. I know nothing about childcare. I know that people stay on lists for years and don't get off them. So it doesn't really matter how far I have to drive. I'm going to call the places in Virgins first. But so that was confusing. I just got a list of phone numbers and nothing to really distinguish them from one another and where to start. And what we did, we called the closest center first, because I don't know the difference between home-based care and center-based care in terms of quality. I don't know the first thing about it. And got a slot at NADU's in March. So we'll have a 3-month gap, and we haven't started working on that piece of it yet. And I guess our thought is then to go down the home care list in Virgins and try and find interim coverage, but I don't really know what to do, and those resources kind of came out of the fire hose, not so much with a little bit of hand-holding to help navigate them.
So something like creating a better triage system for families that are looking for care, to say, why don't you?
Or it also feels, I'm not to speak for Ginny, I don't know her, but that maybe she has to sort of reinvent the wheel every time of sending somebody resources rather than there's only 160 slots or whatever. They probably, I was looking at the total slots line, not the number of providers line, but they probably all fit on 1 or 2 pages, right? And these are the centers and where they are. These are the home-based providers and where they are. And here's 50 words or less what the considerations are between centers, home providers, and this is the first I've heard of the STAR system.
So that we will work on for you. I mean, both in hard copy and also we think it can be an interactive website. A lot of people are going to have to leave. And does anybody have any last pressing question that we want to put into the slot to ask Alexa and Heather to look at? Yes.
My only question is, my kids are school age now, so we're out of the early childhood needs. And so every summer it's a panic. I start panicking in about January about what to do with them over the summer. And I've just been piecing it together with young girls I know with a license who can nanny, which is not, it's great, but it's expensive and, I don't know. So I just don't know what to do with school-age kids during the summer who need care. Summer, I don't want to do summer camps all year long. That's really expensive and really exhausting, and so I just feel like there's a little bit of a gap there too.
That's work we've worked on too in IFS and integrating family service around sort of creating a spectrum of care. I think the other critical piece in summer care is are the last weeks of August, because there's nothing.
Yeah, summer camps are
so
fun.
I'm in favor of creating the European, everyone takes vacation, but.
Yeah. There we go, we solved it.
But I haven't gotten everybody to sign on to that, so.
You're there, okay.
That's
what Congress does, right?
Well,
Recess and those guys.
Well, we recess as much as that, not we being in.
Yeah.
But, yeah, it's a huge issue, and the 9 to 3 thing is a huge issue.
Yeah.
And then this is a total mystery to me because I'm not worried about 2 and 3 years old yet, but the daycare provider on South Water Street on Monday, Wednesday, Friday, they're 3 and 4-year-old, or 2 and 3-year-olds, and on Tuesday, Thursday, they're 4 and 5-year-olds. Is that a model that people actually need, just 2 days a week for their older kid and the other 3 days a week for their younger kid?
Well, they're full, so it works for some. but-
Well, we'll keep working. Thank you all. If you have specific questions that come up, email one of us, and we'll send you that list of people's names and contact info and phone numbers. And it sounds like, it's fair to say, well, my primary focus, I have to tell you, is to get healthcare financing in here. So, and we thought we really needed, though, a much more coordinated system in the county before we could figure out how to have that be a positive add.
Healthcare financing
For childcare.
which hasn't been done. I mean, in the research, we thought it would be easy at first because we thought Medicaid would kick in dollars for early care and learning, because it makes sense, because everybody knows how much, if you look at the Heckman thing, and you look at health and everything long-term, it just makes sense, and we know all that, but Medicaid says, no, there haven't ever been any studies that demonstrate that really high-quality early care and learning experiences, if you have child care, that they translate into these healthcare benefits, and so they won't put any of their money there. So we need to figure that out, to demonstrate that in a different way. Because we need to demonstrate what we know.
Quick question on the independent publication that's
Yeah.
coming out.